Start. Excellent. All right. Good afternoon, everyone. My name is Amy Yarnell, and I am the head of Data and Bioinformation Services at the Health Sciences and Human Services Library. I'm pleased to welcome you all to Love Data Week 2026. This is the seventh annual Love Data Week we've celebrated together at UMB. The theme of this year's Love Data Week is Where's the Data? And to that end, we are going to spend today's session giving you an introduction to the rich ecosystem of data resources we have here at UMB. So we will have three short talks in this session. First up, I will introduce you to some of the data resources we've developed or that you have access to through the HSHSL, things that will help you with finding, accessing data, and sharing data. Then I will hand things over to Professor Eberechukwu Onukwugha from the School of Pharmacy, who will discuss Medicare datasets and other large datasets they have that are managed by the Pharmaceutical Research Computing Center. And last but certainly not least, Wanda Hill from the UMB Institute for Clinical and Translational Research will talk about the process of accessing clinical data from the University of Maryland Medical System and the Trinetics Query Tool. We know that this is just a taste of what we have to offer here at UMB, so we hope that to be able to bring you additional sessions on other resources in the future. So please be sure to complete the evaluation that you'll get at the end of the session and let us know if there's anything else that you'd like to learn about. If you have questions for any of the presenters, please be sure to put them in the Zoom Q&A. So that might be under the More section in your Zoom menu. So just if you can use the Q&A instead of the chat so things don't get lost. And each presenter will be able to answer some questions after their talk. So before we get started, I also just want to put in a quick plug for our Love Data Week event tomorrow, in which a representative from the Qualitative Data Repository will talk about that service and more generally about managing and sharing qualitative data. Be sure to register if you're interested in that topic. And if you're able to stop by the HSHSL tomorrow morning, we will have a table with some donuts and coffee, and you can pick up information about data services. And that will be starting at 10 a.m. in the library lobby and while supplies last. Okay, so now I will talk about the HSHSL's data and bioinformation services. Um, and the resources that we have available to help you find and share research data. I'll talk about a couple of the resources that we've built at the library and also some repositories and other resources that we have memberships with that provide some additional value to the UMB community. Oops, sorry, 1 second. And yes, I will share slides from this as well. Okay, so our goal in the Department of Data and Bioinformation Services is to support researchers at all stages of the data lifecycle, from the time you start planning a project through collecting and analyzing data to sharing and preserving data. We offer various levels of support. So if you prefer a more self-service model, you can always visit our website and read up on a variety of data-related topics. We also host workshops and presentations like the one you're in today, or we offer consultations for one-on-one support, and we can collaborate in a more in-depth way on projects and grants. So the first resource I'll talk about is the UMB Data Catalog. The goal of the catalog is to facilitate the discovery of datasets that are created by UMB researchers. While the data catalog is not a repository itself, catalog records provide extensive metadata about datasets. So this is a great place to showcase the work that's being done here at the university and a way to potentially find collaborators. When you share published data, consider submitting information about your dataset to the UMB Data Catalog. These records are a great way to boost your data's visibility on campus and beyond. You can use the link to your dataset record in articles, CVs, progress reports, and more. And we've created an easy-to-use form to make sure that your dataset is listed. And again, I will share these slides out so you can get these links. So if you need help finding data for secondary research in a more general way, we've put together a guide that contains an index of some major public data sets by topic. So this isn't completely comprehensive, but it's a really great place to start for a variety of topics. The guide also has strategies for finding data and guidance on evaluating and citing data. Another section that we've added recently is a list of alternate sources for finding government data sets. So a lot of government data sets lately have been removed or changed, or different resources are no longer being supported. And librarians and other groups have been working to create archives and mirrors of as many of these data sets as possible. So if there's a data set that you are looking for that you used to work with and it seems to have been moved or changed, be sure to check out our Finding Data guide on archived government data for potentially other um, backups or archives of that data. Another great resource for finding data is ICPSR. That's the Inter-University Consortium for Political and Social Research, which is based at the University of Michigan. It's a large, well-established repository and a great place to find health data with behavioral, social, or political components. It serves as an archive for some large public surveys like NHANES, and it also has an archive of census data. UMB has an institutional membership, and as a member organization, the UMB community receives full access to all ICPSR data. So you can go to the website and download it. You do need to be either on campus or on the campus VPN to access that data. Along with finding data, it's another great place to share your data. And ICPSR has template language and budget estimates to include in your data management and sharing plans. There are a number of NIH-funded collections that are under the umbrella of ICPSR. So I have a couple on the slide here, things like the National Addiction and HIV Data Archive, National Archive of Computerized Data on Aging, Data Sharing for Demographic Research, and there are others that are associated with other health organizations as well. ICPSR offers two different models for depositing data. It can be either curated or self-published. So in the curated model, professional data experts at ICPSR will review your data for privacy risks and create a metadata record to make your data easily findable. They'll convert your data into downloadable files for common statistical programs like SPSS, SAS, and R. They'll compile documentation, create a standardized code book, and suggest a data citation. They can also add variables, or your variables will be added to an ICPSR-wide database of social science variables that help connect it with other studies in the archive. There may be fees associated with curated deposits, so if your data has complex needs or you wish to make your project open access. Alternatively, you can self-publish your data for free in Open ICPSR, and this archive is particularly well suited for small replication data sets linked to a publication. With Open ICPSR, the researcher, on the other hand, you don't have to pay, but you are responsible for cleaning, formatting data, creating metadata and documentation, and reviewing it for disclosure risks. And both ICPSR and Open ICPSR have options for controlled or restricted access to data when you can't make it completely open. So that's a really great option for health science researchers. I won't talk too much about the qualitative data repository now because that is what we'll be having a session on tomorrow that I mentioned in my introduction. But just to know that it's a repository for qualitative data in a variety of formats, things like audio and video recordings, transcripts, oral histories, and more. It's a curated repository, so if you choose to deposit data there, you'll get the benefit of working with experts who understand how to keep qualitative data safe and secure and make it usable for other researchers. Our membership in QDR covers the cost of 5 deposits a year. So if this sounds interesting to you, please be sure to register and come to our talk tomorrow. Now, the Open Science Framework, or OSF, is a collaborative project management platform where you can organize and share projects. It's increasingly being used as a generalist data repository, so repository that can accept any kind of data. It's great for small, non-sensitive data sets, basic science research, that kind of thing. So OSF also offers a protocol registration service, and it can integrate with tools you might already use, like GitHub or your citation manager. It's a nice place to keep together documentation, data, instruments, citations, just have all of these things together in an easily shareable form as an all-in-one tool. So we do have a guide on the library website to get you started with this platform. And one of the benefits of our membership are that you can log into OSF using single sign-on with your UMB credentials. So you don't need a new login. And there's a UMB landing page that highlights projects with the university affiliation. And finally, I want to talk about the NIH All of Us research program. So the goal of All of Us is to build a large, diverse database to advance developments in precision medicine. Participants are volunteers who agree to share data from a variety of sources, including electronic health records, biosamples, surveys, measurements, and wearable devices. So not every participant will have all of that data, but that's the variety of sources that the data comes from. Currently, they have data from over 600,000 participants from all over the country, and anyone can access the aggregated data from the public data browser. But because of our institutional agreement, UMB researchers can access de-identified patient-level data, including genomic data, through the cloud-based researcher workbench. And you can find the research program website at researchallofus.org. The researcher workbench is a secure cloud-based data enclave, somewhat similar in principle to UMB's secure research environment, and that no data can be removed from it. So that keeps all this patient level data nice and secure. And there's a variety of tools built in for creating cohorts and analyzing data. So both options that are more point and click, where you can work with the graphical user interface, or programming tools like Jupyter Notebooks for R and Python. There is a little bit of a process for registering, so we have created a step-by-step instruction guide on how to do that. So that is it for me and for introduction to the library. Again, if you have any questions, please go ahead and put them in the Q&A. And again, the Q&A might be in the More section of your Zoom menu. And while you're doing that, you can use this link to find out more information about the HSHSL data and bioinformation services, or you can find us from the HSHSL homepage. Please feel free to reach out at yarnell@hshsl.umaryland.edu, or if it's easier to remember, you can just go ahead and email data@hshsl.umaryland.edu. So we have a couple minutes. I can take questions now and potentially if there are any at the end. Um, okay. So far the only question is about slides and yes, I'll send out slides and recording afterwards. So any other questions right now about data services? Okay, so the next question, so one question we have in the chat is about getting real life clinical data from EPIC, and you are in the right place because that is what our third presenter, Wanda, will talk about. Okay, so if anyone thinks of any questions for me, you can feel free to put them in the chat. I'm going to stop sharing, and next up we'll have Barry, and Barry, I'll let you get your slides up. And while you do that, I will introduce you.
Thanks,
Okay.
Amy.
So Ebere Onukwa, PhD, is a professor in the Department of Practice Sciences and Health Outcomes Research and is executive director of the Pharmaceutical Research Computing Center at the University of Maryland School of Pharmacy. She received a doctorate degree in economics from Virginia Tech and has 20 years of experience conducting health economics and outcomes research. She has authored over 150 peer-reviewed articles, and in her work, she uses various types of real-world data, including administrative claims data, hospital discharge data, registry data, survey data, and electronic medical records. She also has experience using physician level, hospital level, area level data. She is an editorial board member for pharmacoeconomics and an associate editor for ethnicity and disease. So thank you so much for being here, Barry, and take it away.
Thank you, Amy. Appreciate the kind introduction and thank you for the opportunity to be part of HSHSL's Love Data Week. This is really quite exciting. Um, Good afternoon to everyone. It's a pleasure to be here. And I'll be talking about something related to where's the data and focusing on where's the real world data. Because that is much of what I do on a daily basis is as a researcher work with real world data. And then Amy had mentioned the role I have with pharmaceutical research computing, and we'll talk a little bit about PRC and its role facilitating access to real-world data. So I'll be primarily focused on health services research projects and the data sets that support them. By way of an outline, I will begin with more just kind of level setting on what are real-world data. And then I'll talk about real-world data sets available through School of Pharmacy for our University of Maryland, Baltimore community. And in that, highlight two key resources that facilitate use and access, one of which is Pharmaceutical Research Computing Center, and then our department's community database program, both of which are instrumental for researchers like myself within SOP who work with these data sets, as well as clients of PRCs, researchers across the different professional schools at UMB who are utilizing these data. As Amy mentioned, same here. So please feel free to stick your questions via the Q&A function as we go, and I'll be happy to address those at the end. So what are real-world data? They are, as you see in this definition, provided by the Food and Drug Administration in recent guidance, focusing on particular subsets of real-world data. They are defined as data relating to patient health status or the delivery of healthcare. And we're focusing on healthcare and associated data routinely collected from a variety of sources and many more sources than I have time to overview today. So what I've listed here are common sources of real-world data, and some of which have been mentioned in the prior talk. So we have EHRs, which are, as many of you already know, data generated in the context and course of providing clinical care to patients. We also have administrative claims data that are part of RWD, and these include insurance claims data from public payers. I gave the example on this slide of Medicare data. We also have administrative claims data coming from private payer sources. So different kinds of payers, United, Blue Cross, Blue Shield, will oftentimes make data sets available to researchers under very strict protocols and data use agreements that govern use and access to claims data. I'll also talk a little bit about registries. So these are very highly focused and unique real-world data sources. They can be disease-based. There are oncology registries, registries for different chronic conditions. There are registries for rare diseases. They can also be device-based. And in that case, oftentimes used for post-marketing surveillance work. And as vast as these different data sources can be in terms of the populations covered, they don't necessarily cover all the measures that we would like to have with our research. So we do like to take advantage of surveys because they provide a unique source of patient experience data This is where you'll see your patient-reported outcomes, patient-reported cost measures. Also part of RWD, we have patient-generated data. More and more likely to see that datasets are available to researchers that include generated data from patients who are either using internet connected devices in their homes or wearables. And those are increasingly available for research, which is quite exciting. And last but not least, here I'll mention geographically organized resources that I've used in my work, and many researchers have also used in their work, where they are linking census data, other types of data sets that are organizing data at the area level. And there we would have county, zip, track level, even measures available that can provide additional context around observed utilization. And so any of these data sets, as I hinted at, have strengths. They also have weaknesses. And so it's important that as you work with these data, that you are involved with a team that can provide that expertise, or if that's expertise that you bring, you'll certainly appreciate some of this information. So here, what I'm doing is providing particular focus on administrative claims in terms of measures on that left-hand side column, and some notes based on my thoughts and having used these data sets over a number of years. What are some pros and cons with claims? So claims are utilization-based. It's going to be providing detailed information for individuals with healthcare coverage and healthcare utilization in terms of the covered health services that they are engaged with over a period of many years, potentially. So really very detailed on utilization in terms of number and type of utilization, also costs in terms of what the payer is reimbursed. You also have out-of-pocket costs available in these data sets. In terms of quality of care with that second row, we don't have great information on that. Nothing at the patient level, because this would have to be patient reported. And so you either have an opportunity to link out to a data set, for example, if you're thinking about quality of care metrics, linking out by provider ID to other data sets, you could get access to quality of care that way. And then in terms of the third row, specific to the patient experience, this would not be available in claims because it would be patient reported. And then thinking about costs, I had mentioned earlier that we do have healthcare system facing costs available in claims, as well as out-of-pocket costs. What we don't have in claims are costs from the patient or family perspective. And by that, I mean costs, transportation costs, costs incurred either directly or indirectly in the context of seeking healthcare, productivity loss, things of that nature would not be available. And then the next row there is our social determinants of health. There are billing codes available in claims data for SDOH. However, they are incomplete, differential, and so can be quite problematic because of the incomplete billing and use of the SDOH. So that can be something that most researchers would prefer to use the area level. And by that, I mean linking through some of these geographic resources, area level, zip code, county level information on social determinants. That is quite possible and oftentimes done with claims data. Looking at that second to the last row there, claims do not include information on why we see the utilization. So we will see utilization or lack thereof, but we don't have reasons. That again would need to be self-reported and sourced externally. But there are opportunities with claims to link to different sources of data. I hinted earlier about hospital level data, while you can also link physician level data with provider IDs, area level. So really quite a lot of opportunity to enrich your understanding of the patient level utilization and costs that are visible through the utilization data. So I want to provide a quick overview of pharmaceutical research computing. because it is a key resource for us as we're accessing these data sets that are made available. And then I'll provide an introduction to the infrastructure that's available to us for accessing the data. So who is PRC? Pharmaceutical Research Computing. We are a university designated organized research center located within the School of Pharmacy in our P-Shore department. Established in 1998, the PRC is a unique campus resource in terms of providing HIPAA-compliant, secure access to these types of data, along with staff who have that expertise in programming on these data sets and creating analytic files for different clients. PRC has been used by many investigators across campus. Some of you may already be familiar with PRC. And then finally, the director having UMB PI status does provide that flexibility to support clients either directly or supporting PIs as well who are coming to PRC for services. And in terms of the services that PRC provides, here's a high-level overview. Starting at that top with the deep blue is data acquisition. I'd mentioned that the data sets oftentimes are governed by data use agreements following IRB approval. Some of these DUA processes can be quite extensive and intensive, and PRC has just a lot of experience navigating that DUA review and approval. And so that's an important service that our clients really find quite helpful. I'd already mentioned as we go clockwise there, data warehousing being a service that PRC provides. And then I'll talk in the next couple of slides about our community database program. But that is something that we're really pleased to be able to support from the PRC side. And then finally, the last three sections of this wheel here, a key service as well for PRC is that project management, providing documentation, literature review, support for publications to clients, and then closing out this wheel, just that core service of the programming expertise on these data sets in terms of working with the raw data to create data analytic files for different teams to use. And then lastly, PRC also has access to PhD level researchers and clinicians who can support clients with different measurement or other analytical concerns. Here's a quick snapshot of PRC's experience with data sets. I won't spend a lot of time on the different data sets, more just kind of highlighting the ones in blue on the blue button, because I'll get into a couple of these when I talk about our community database program, which is supported through the department. So as you can see here on the left, PRC has experience with National Cancer Database, SEER Medicare, which is a linkage of NCI's cancer registry to Medicare claims data. And then the Chronic Conditions Warehouse is Medicare's own data product, oftentimes abbreviated as CCW. And we've also worked at PRC with VA data. And then this last button here, I do like to highlight for those who do oncology health services research, really nice to have access and experience with this linked file that takes our Greenebaum Cancer Registry data linked with EHR and Medicare claims data as something that's available to researchers. Lastly, here, in terms of PRC's experience, we've worked for many years with the Medicare Current Beneficiary Survey, MCBS, which is a really neat resource that links patient-reported outcomes on costs of care, ability, expenditure, all different kinds of aspects related to healthcare utilization with claims. So it's a really nice kind of traditional linkage that Medicare has supported for many years. And then IQVIA, which is private payer claims data. PRC has that on our server and facilitates access to that, working with our community database. And then finally, other private payer data sets, Optum Labs we've used in the past, and then our all-payer claims data sets, which are state-based. Maryland's APCD, if you will, is one that PRC is working with right now for a particular client. And so now I want to talk a bit about our community database program. This is the umbrella infrastructure that any researcher who's interested in accessing these data sets will work with. And then after getting that sort of approval and application through our PSURE community database program, then they connect with PRC for specific access to the data on the server. So this community database program, I'm a member of the committee. It's chaired by Susan Dostries, who's a faculty member in the same department where I sit. And so the community database program, as the name suggests, uh, covers databases that are not covered financially by a single PI, a principal investigator, and that provides an opportunity for multiple PIs to use it. This is not the case with all data sets, but certainly is the case with our CCW data products, and you can see those listed here, as well as the MCBS, the survey linked with claims, and IQVIA, which is our private payer closed claims database. And so these are the core parts of our community database program available to UMB researchers. We started this community database program because these data sets are expensive. And there's certainly value in, we saw a lot of interest in using these data, but certainly cost and access can be a barrier because it's difficult even if you were to secure a cut of data for a particular project, not always easy to maintain that over time. And so we saw that as a barrier that we could potentially address with this community database program, allowing researchers to sort of buy into a database that does get refreshed, does get added on to over time. And so economies of scale then can be realized with this cooperative shared environment and resource. As I hinted at earlier, there are data sets that are not part of CDP, particularly our C Medicare files. Those are available typically to PRC because individual researchers are working with them. PRC does have a file, a 5% cancer file that it manages, and clients can work with that file. It's very similar to Medicare's version of the 5% file, so a random sample of its population. And so great for questions where you're working, for example, across tumor sites and not specifically in one particular site. So the community database program managed by our department, I've listed the data sets here, and I've already talked about a Medicare current beneficiary survey, our CCW data set, IQVIA, and then the HSCRC these are hospital discharge data that PRC has been supporting and the CDP can provide access to. And then finally, we have Policy Map, which I'll talk about in a second. But that is a unique file providing access to these geographically sourced data sets. So just a little bit about IQVIA. It is a longitudinal health plan database. What we have available is a 25% sample. And so it's primarily provided to us for unfunded academic research. And so those are some of the criteria that we being the community database committee will investigate for individuals who are seeking access, that we're meeting the criteria stipulated by the vendor. And so most will have commercial health insurance, although you'll see some with commercial Medicare or Medicaid in the data set. The years covered include 2006 through 24. And we've, with our particular contract in this cycle, negotiated additional data refreshes in outgoing years. There is no DUA required. Like I say, there are some conditions for use in terms of funding. And so these are things that we can follow up with individuals if they are interested to hear more about the IQVIA file. PRC can then also work with you on your application. So feel free, if you were interested in this particular product, to be in touch. Then I also want to just talk a little bit about our CCW file. Similar to the IQVIA, this is also a longitudinal file focused on our Medicare fee-for-service population, so traditional Medicare, if you will. And the CCW, chronic conditions, is named that way because it includes pretty robust list of flags or indicators for beneficiaries who have evidence of a diagnosis among the list of chronic conditions that they are focused on. And all of that is available for those who seek more information. In terms of the years available, you can see listed here, 2006 through 2024. This is as of the end of 26, we'll have the 24 data. Right now we have through 23 data. And you can see we have a 5% random sample for our older cut. And then for a more recent cut, we have the 20% random sample of our beneficiaries. So pretty robust sample sizes for these data. Now, unlike our IQVIA file, the CCW is governed by a DUA, and there's a particular process that has to be followed to secure access and use for the CCW data. And as I mentioned before, PRC staff have many years of experience working with this DUA process and very happy to facilitate for those who are interested in accessing. Now, just a quick word about data linkages, because that is very important to many of our work looking at utilization. There are frameworks that motivate a multi-level, multi-domain look when we are considering utilization. Here's one example. I do a lot of work in oncology. So this is an often cited paper in that space. And you can see the figure off to the right there discussing layers of influences that can impact observed utilization, observed costs. And to get at these different layers, we're oftentimes having to link out to different data sets. And Policy Map is a licensed data product that includes many thousands of indicators curated from public and proprietary data sources, covering measures related to demographics, housing, environmental conditions, health and health services at different area levels. So you can think about, the track level, zip code, county. So really quite rich data source there. And just a snapshot here of different papers that are describing and also using Policy Map. So to summarize, that RWD, or real world data, include a rich variety of data sets that we take advantage of for our health services research projects, many of which are available to UMB researchers through the PSURE Community Database Program, and then facilitated by Pharmaceutical Research Computing. You are welcome to contact me. I have my email up here with any questions about use and access. And Dr. Dos Reis chairs our community database program. And then Avery Johnson is director. And so in that role is our day-to-day overseer there for PRC. And I will stop sharing for now and see what questions you might have.
Thank you so much for that wonderful presentation. Even having worked with you before, I learned a lot from that, so that's great. So let's see. We have one question so far. Can you talk about the costs of using PSURE data and the logistics of being able to access it?
Yeah, absolutely. So the community database program maintains a one pager to discuss for each data set what the cost may be. And it ranges anywhere from $2,000 to $3,000 to $10,000 per year of access. And all of that is varies because the cost to access and procure these data sets varies quite a bit. And so we'll be happy to provide more detail to anyone who's interested in a particular data product among the ones that I listed.
Thank you so much. Would you say, are people usually paying for those? Do they have grants or department funding, or do you have any sense of where they get the funding for it?
There are a variety of sources, and it'll depend on the data set as well, and the number of years that they're seeking. We've had individuals come with their own funded projects. We have some will have pilot money that they have available to them. We've had folks complete ICTR requests. I know that Wanda's coming next to present. And so we've had individuals use a variety of different sources.
There's also a question of if there's discounts for students, or are students able to access this data too?
Yeah, oftentimes, and great question, oftentimes the students that are accessing the data are accessing it underneath of a faculty member's access. Now, for IQVIA, for example, we have several students who will use it for their dissertation, and that's available for that purpose as part of our data use agreement with them. In terms of other kind of use cases for different data sets, CMS charges a one-time flat fee of $2,000 for reuse. And so that one is something that, a project would have to absorb depending on whatever source that they have available to them. It's more of a pass-through cost from our university to CMS.
It's great. Thank you
But it
so
does
much.
depend on the data set. Yeah.
That's so helpful to know about. And Wanda helpfully put a link to the ICTR voucher program, which can
Oh,
help
great.
offset costs. So thank you so much for putting that,
Wonderful.
Wanda. And yeah, if you have any links you want to add, Barry, go ahead and put those in the chat. If there are any, we have another minute or two for questions. If you have any to add. I do want to go back to, there was one question about the data catalog where it'll sometimes say things like unrestricted access. And does it mean that if it says unrestricted access, does that mean that it can be requested for further new research or be built upon? So in the data catalog, if it says unrestricted access, that generally means that you can just go to the website, download it. And then if it's restricted access, you may have to apply and have a justification and our IRB approval. And again, we don't manage that through the data catalog, but we will have instructions for that. And anytime you use other data, um, another researcher's data to develop new research, just like a scholarly article, you would want to cite the data set and be sure to recognize the other scholars' contributions. Okay. Any last questions for Dr. Onukwugha? Okay. Well, again, if you have any others, put in the chat. Thank you so much, Dr. Onukwugha, for being here and telling us about all these great resources. And now I will introduce Wanda and go ahead and you can start getting your slides up while I introduce you. So Wanda Hill, formerly Wanda Coral Fink, came to our campus over 30 years ago with a background in pediatric and adult hematology, oncology, and ICU nursing. Most of her years on our campus have been dedicated to clinical research project management. In 2017, she joined Dr. Stephen Davis and Megan Banchero as one of the original team members who stood up the UMB Institute for Clinical and Translational Research, the first university-wide initiative to bring resources to faculty, predoctoral students, and postdoctoral fellows to support clinical translational science and improve patient and community health. As the ICTR Director of Operations, Wanda navigates multiple areas of ICTR and campus resources, working to identify those that may address researchers' needs. Patient data to determine study feasibility is one such resource researchers request often, and this is what Wanda will focus on today as she presents to us information about Trinetics, a portal where researchers can independently take these initial steps towards cohort discovery prior to submitting proposals to the IRB. So Wanda, please take it away.
I always have to find how to turn on the volume. I typically don't, you have to make me shut up, but now in this case, I have to figure out how to talk.
We can hear you and loud and clear and see your slides.
Great, wonderful. Well, thank you, Amy, for inviting me to present today and share information about how researchers can request EPIC data for research and information about our Trinetics platform. I want to go back. Well, this is, I inadvertently advanced this slide. And so, but what I'll do is I'll just highlight that for those individuals who are not familiar with the UMB ICTR, it is the first campus level institute that focuses on providing resources to our schools, our 7 schools on our campus, and some of our partners at UMBC and College Park, resources to help facilitate their research. We have a large suite of cores of services, and this includes biostats and informatics, and we have a pilot grant program as well, and a K&T training program. But for today, we're going to focus just on the informatics services because that is where you will find information about accessing EPIC data for research and Trinetics. Let me get this to advance. There it goes. Okay, here we go. So again, this is our suite of informatics core services, but we will just be focusing on Trinetics and EHR data. So just to give you a little bit of background, to support a research using EPIC data, the UMB ICTR and UMS jointly founded and funded a shared resource, the Clinical Research Data Informatics Subcore, to centralize and streamline the provision of UMS EPIC data for clinical research at no or little cost to the researcher. This collaborative undertaking between UMS and UMB supports the mission of UMB by improving clinical and translational informatics and access to UMS clinical and translational data for research conducted by UMB researchers. With this collaboration, we also added Trinetics, and I'll talk about Trinetics here in the latter half of the presentation. So we're looking at the UMS EPIC data assets. So what is in UMS? We know that this EPIC data began with January 1st, 2016, because that's when UMS adopted the EPIC data platform. And it has currently nearly 2.5 million patients as of last month. And this is covering 14 facilities and 150 plus ambulatory and physician practice sites. I just want to go back to, you can see this spread of demographics of this patient population that's in our EPIC system. So individuals who are interested in accessing UMS clinical data for research, the request for this data must come through the ICTR via the ICTR resource request form. And the link to that is here on the side, but I'll put that link in the chat as well. Keep in mind that only faculty PI of the project can submit this request. We don't permit proxy requests from students or fellows or residents. And this is because we have some reporting requirements on what were the results of having this data, analyzing this data, whether grant applications, publications. This is information we need to report to our campus leadership. But also we want to make sure that the faculty member is aware of their responsibilities with obtaining this data. So when this request is submitted, we are alerted and we will review it for completeness. And then it is routed to the UMS EPIC team to schedule a consult with the PI. Now the research team can come along, the fellows and students, but the PI must lead the discussion. The PI will be responsible for this data. So UMS UMB does have some requirements. UMS is committed to protecting patient information and abiding by the HIPAA requirements. And they are the stewards of patient record information, and they act as the honest brokers. And per UMS, requests for medical record information for research and even QA/QI projects require IRB review, as well as UMS approval. This includes de-identified data as well. So IRB approval alone does not grant access to EPIC data. This includes data that's obtained through chart abstraction and QA/QI projects as well. And this is a big misconception on our campus that if they do submit a project to the IRB and this is going to be utilizing EPIC data, whether it's an EPIC data pool or if it's through chart abstraction, that if the IRB approves it, that they can go ahead and do chart abstraction. But that's not the case. The the approval or determination is based really on just the risk to the patient. It doesn't really, they're not the deciders of who is granted UMS data. And UMS definitely needs to have information about who is accessing this data for HIPAA reporting. Additionally, EPIC data used for research must be stored and accessed by the research and the team within what's called the UMB secure research environment. And the team members that need access must also be on the IRB team list. Currently, we're looking at, or the campus is looking at other solutions for storing QA/QI projects that are collecting EPIC data. There is the possibility that the UMS team may decide that the data set does not need to go into that environment, but it is their determination, not the researcher. And this is just a little schematic of what the SRE environment looks like. It is hosted on a virtual desktop, log in, and there's the typical suite of Microsoft products in there, including Excel. Other statistical software that's in there is R and Python, but the SRE team can certainly customize this environment to add additional software needed like SAS or SPSS, as well as increased computing power depending upon the size of the data. In this case, you can see there's EMR, there's waveform, cardiac waveform, there's imaging data. So the data storage can be extensive and the computing power may as well be pretty extensive, but the SR team can definitely customize that environment for the team. So if you don't want to go through this process, if you want to just know, is that data available in the EPIC system that I'm looking for? I don't want to go through the process of requesting go through the ICTR. I don't want to go through the IRB yet. I just need to know, is this patient population available in UMS? Is my study feasible? Can I recruit? So this is where Trinetics can really come in handy. And this was part of this data collaboration that was set in place a few years ago. And it's an amazing, powerful tool where researchers can go in and query EPIC data. So I'll start off with that. What is Trinetics? It is a network of healthcare organizations sharing clinical data to expand research opportunities, increase collaborations, and advance treatment options for patients. It is self-service, web-based, EPIC data exploration tool that allows the clinical researcher to query and freely review de-identified aggregate clinical EPIC data from UMS or across the Trinetics research network. UMS is a participant in the Trinetics platform. And with that, our researchers have access to the other participants in this network. You can get what's called a global research data file that pulls data from the participating sites. That data file is de-identified, and you are not able to identify what level or institution that data came from. It's truly aggregate. So you use this tool, you can query Trinetics using ICD-10 codes, lab values, demographic variables, etc. And then it will provide a count of eligible participants, patients. It can also give you a display of the demographics. And using this information, you can decide whether or not you want to move forward with requesting an EPIC dataset or Trinetics Research Network Limited dataset. So how do you access Trinetics data? Just to go back and just give you some information about the types of data that's available in Trinetics, it covers patient demographics, encounters, diagnoses, lab results, medications, procedures, but currently UMS is not contributing any genomics data. It is HIPAA compliant. Trinetics maintains an information security management system that meets the HIPAA security rule. The quality of data, Trinetics curates and harmonizes and fully maps EPIC data to improve data quality and analytics. This data is refreshed monthly. The UMSRIC team pushes in a data file once a month. So if you're looking for information from yesterday, it may not be available in Trinetics until the next push. It all depends upon when the data was pushed. And if you would like to know, our UMS EPIC team would probably be able to give you the information about when the last data push was. If Trinetics, so sorry. If Trinetics identifies a potential data error, like there's a huge outlier, they will not make any corrections to the data, but what they will do is notify UMS, and it will be up to UMS to make a decision, a determination if there's a data correction that's needed. And then with the next push, that data will be corrected. Now, who has access to this data? Currently, it's UMB and UMS employees, but it is only the UMS or the UMB faculty that can actually request data through the ICTR. So how do you do this? You log into the Trinetics platform, you create a cohort query to view aggregate data, and then there's a little yellow button that says request data set. When that happens, the ICTR and the EPIC team are notified, and we will direct the researcher to complete an ICTR request form for consultation with this EPIC team. Now, sometimes there is a team of folks that are building a query for a researcher, and you can have this collaborative environment within Trinetics, but it's only the researcher that can request the data. If a student or a fellow makes the request and submits the button, then we make a determination whether or not that's a valid request. And if it is not, we follow up with that individual to let them know to please have the PI of the project reach out to us, and we can direct them on the next steps. With IRB approval, the EPIC team then will determine if the data file requires the UMB SRE environment. Most cases that often happens unless it's a completely de-identified data set and there is a data use agreement or data transfer agreement in place. So how do you get a Trinetics account and log in? In the beginning, the EPIC team pushed all the campus emails to Trinetics, and we front-loaded all of these accounts. So there is a chance that you already have an account, and the only way to realize that is if you log in. But if you do, and I'll show you that in a second, if you do need an account, this is the form that needs to be completed, and this is an email to the UMS team. EPIC team, and this is the information that you'll want to add into the subject line so that they're alerted that someone's needing a Trinetics account. For non-faculty, please just describe the purpose of your request, like you're working with a researcher on building a query. This is information about logging into Trinetics using your campus email, and if it's valid, meaning you have an account set up, you will be redirected to a UMID login window. And if you do have the account, this is what you're going to see when you log in. The sign-in is up on the right-hand corner. and you're going to select the Trinetics Live. You'll probably get a pop-up window about cookies, so please make sure you accept all the cookies. And this is where you're going to land when you sign in. If you don't have any queries built, this is going to be blank. And so this is where you'll start on your to the right here, upper right, where it says create new study, and that will begin your journey with creating a query in Trinetics. And this is what the query builder looks like. And you start off with putting in ICD-10. You can actually start putting in terms, and it will have drop-down menus that for you to select more structured information based on the text that you enter. So you can have your inclusion, you can have your exclusion here. This is the yellow request dataset button I was telling you about. Before you actually get really into doing this, I really suggest that you learn Trinetics, because if you want your data output to be correct, you want to understand how to build the query. And what's wonderful about the Trinetics team is they're really there to help you. They have their help center, and that's a little question mark up in the upper right-hand corner of the platform. And they have live and recorded training videos, quite a few actually. And then there's the design assistance, which is on the lower left of their window, and you can actually submit like questions. You know, what kind of help do you need? What are you trying to build? And they are very responsive. And we have a great working relationship with the Trinetics team. And if you do want to speak to someone directly, please feel free to email me and I can help get you connected. And this is a suite of their training programs. Okay.
All right. Thank you so much, Wanda. That was so informative. And I really appreciate you talking to us about that. I see one question right now, and if you have others, please be sure to add them. So the question is there a way to streamline the application so that when an IRB is submitted, the UMS requirements SRE submitted at the same time? Right now, it is a multi-step process.
I think that from our experience that it helps if you initiate an IRB submission, but don't submit it until you actually have the consultation with the EPIC team, because you'll want to be able to provide information about the data variables that you're collecting, where the data is going to be stored. And oftentimes researchers make statements that we're going to be collecting vital signs, or we're just going to be collecting XYZ data. That data may not be available. It may not be available in the time frame you're looking for. And also we see errors in where data is stored. Data can no longer be stored on shared drives or teams. The UMB leadership really prohibit storing data, EPIC data like that. Really goes against HIPAA. So I suggest go ahead and get it started. Put in as much information as you can into your IRB, but don't submit until you have that consultation. And that way you can make sure that you have the correct information about where it's stored, who's going to access it. Because if it does end in the SRE environment, you will want to make sure that you include all the individuals on your IRB list that you want to access that data in that environment, including a statistician.
Thank you. That's great advice. Any other questions for Wanda? I have one that actually probably both Wanda and Barry could answer. How much time should people give themselves for the request, for to request UMS data or to request data from the community databases? What is the approval kind of process and data pool process like? Maybe Wanda, if you want to start.
I can start with the EPIC data request. Once that application is submitted, we typically process it within, 2 to 3 business days. And then it's forwarded to the EPIC team. The researcher is always included on that email, and so they have the individuals that they can expect to be meeting with. They're also included with that email, and also how to contact them. So if there's any delay, if you don't hear from them within, 2 or 3 business days, please reach out to them, to me, and I can just nudge them to say, hey, this person is waiting to have a consultation. The amount of time it takes to have a data pull really depends upon the complexity of the data that you're looking for. If you are wanting to search clinic notes, or it's a complex query that needs to be built, then it could take some time, but it really depends upon that. But I would expect that if it's pretty straightforward, you could probably expect to get a access to the data. Well, it depends too, because if the environment needs to be built, and that environment, the SRE environment, if that data needs to go into that SRE environment, then there is the vanilla SRE environment, and then there's the custom. Do you need to have teams in there? Do you need to have software added? Licensing? Do you need extra computing power? How much data are you bringing in there? So that determines as well, because that environment needs to be built by the SRE team, which is not our EPIC team. And once that environment is built, and they will consult with that researcher if it needs to be customized. So that could cause a delay as well. But typically, worst case scenario, maybe 3 to 4 weeks. Best case scenario, a week or so.
That's great. Thank you. Barry, you are muted.
Yeah, great question about timing. So with regards to the PShore community databases, there's a committee, and primarily I would direct individuals to Dr. Dos Reis. Feel free to email me and I can help connect the dots. But the process for accessing those data sets would be getting the approval from the Community Database Committee, which involves completing a data access agreement. There's a form that we provide for that. It helps us track use of these data sets. And then the next step after that would be to secure IRB approval for the study that's being planned. And then depending on the data set, it could be a requirement for a DUA. So for example, with the CMS data, even after the IRB, there is a DUA process that's really driven by CMS. So that's external to UMB. And I've seen that take weeks sometimes, or months sometimes. Depends on how complex the research question is or the team setup for the particular study. And then there are other data sets that don't require DUA. So after your IRB, then you're ready to go. You'd be set up for access.
Great, thank you. So I think the message probably for all of these data sets is to plan ahead. Thinking early on in your project about what your data needs will be and what sort of documentation you might need. I do have one more question before, and if others have questions, feel free to add them, or if you want to raise your hand and we can unmute you. But if you have to leave early, then please be sure to there'll be a little evaluation pop up, and be sure to answer that as you leave. I want to add a link to just some of the resources I talked about from the library while in the meantime, so you have those until I send out slides. So just again, if there are other questions, please put them in the chat. But I was wondering in the meantime if you have either of you have kind of general advice, things that you see that maybe can lead to holdups or people, maybe things that you would want people to know kind of at the start of, requesting the data. What sorts of, maybe tips or advice or things like that do you have? Yeah, Wanda, do you want to?
Oh,
start.
I'm sorry. Did it look like I was raising my hand?
You unmuted first, so you get to go first if you like.
Well, I want to just go back to Siddhartha's question about streamlining. I think that the process really moves along more quickly if you've really thought through the data that you need, what the variables are, maybe the domains that this data exists in, and get the IRB submission started right away because nothing can be released until that IRB is approved. Think about your team members, make sure all the training that they need is in place. City training, if they haven't had HIPAA training, we've actually run into that a couple times where individuals don't have that, and that is required as well. So as much of that upfront that you can get done. And then when you can go ahead and start the ICTR resource request, but again, you'll be meeting with the Epic data team and they'll provide you with information about where it's going to be stored, how long it will take, um, and whether or not, if you're planning on needing to move that data out of that environment, whether you might want to consider like a DUA or a data transfer agreement. But really planning before you start moving forward and understanding the data you need. You can always do the ICTR resource request if you want that initial consultation and go, look, I want to do this. Is this data really available? And you can do that. That we won't bust your kneecaps over that. And so it's if you feel comfortable then you initiate the IRB and move quickly, but make sure your team members have their training. And but yes, unfortunately, it's not nothing can be done all at the same time. It takes a little bit of iteration back and forth.
Thanks. That's great. Barry, did you have stuff to add?
Yeah, no, just, very much supportive of the point that Wanda raised around knowing the data. It's nice that the ICTR has created infrastructure around to facilitate getting those questions answered, right, before you do a formal submit of your application. And in our case, it's less formal, but we still do advocate for people to reach out with questions because we know these data sets are complex, some of them more so than others. And some of these DUA applications do depend on you knowing your data. They'll ask you about specific files, years, subsets of files. And so, to the extent that you can marry your research question not just to hypotheses and expected outcomes, but to measures and different files, that really speeds along the DUA review. And then I would also say, in addition to what's already been said, that the IRB looks very differently at what's shared by the researcher than a DUA approver, for example, like a CMS. There, they're looking at the research question, the feasibility of it with the data, because they know the data. And I've seen DUAs that were really well written in terms of maintaining privacy and confidentiality and secure access fail because they were not feasible with the measures that were available in the data. So we're available to help as a community database committee, PRC as well, because sometimes the first question is what's in the data? What can I do with it? What can't I do with it? And so I would definitely recommend getting those questions answered before submitting applications.
Thank you for that advice.
Amy, I
Oh,
just wanted to add a couple more points
mhm.
to this. Just a reminder, UMS is really, and UMB, the campus leadership, is really insistent on our QI projects going through the IRB review process. That seems to be something that's being skipped. We have providers that may think that they're going to do a QA project. They're looking at chart information on patients. They're collecting data, and it could be in REDCap, which we don't permit anymore. With it, that has to be in the SRE environment as well. So the campus is really locking down on making sure that Epic data is stored appropriately and that it's not leaving this campus without the appropriate approvals. And that includes do not put chart review Epic data into a REDCap that exists off of our campus. That's prohibitive. That is transferring data, and without a data transfer agreement, you're violating campus rules and HIPAA as well. The other thing I want to highlight is the misconception about de-identified and identified data or limited data sets. When it comes to EPIC data, you have to look at what are the HIPAA identifiers. Do any of those exist in that data set? If so, including encounter dates, it is not de-identified. If it's missing everything except for maybe encounter dates, then you're still looking at a limited data set, which is not de-identified. So we want people to keep this in mind, become more informed about what data are and how your responsibilities for safekeeping this data. And we want you to be successful with your research, of course, and your QA, QI projects.
Thank you for adding that. Those are really important points to keep in mind. And definitely look out for, I think, trainings from all these different all of us who do trainings on different types of data management and things like that. I don't see any other questions. Though I'm sure all of us would be happy to answer things by email if you think of things later on. So I just want to thank you both, Abere and Wanda, for sharing this great information. I think it was really helpful to hear about all in one place. Thank you to our attendees, and please be sure to complete the evaluation that will appear in your browser when you close out of Zoom, and be on the lookout for us to share the recording and the slides. Going to stop the recording and enjoy the rest of your Wednesday.